In today's medical moment, we are talking about spider veins and varicose veins. Once thought of as something that only the elderly have to deal with, they're actually a lot more common than that.
Yeah, but 20% of all Americans will have them at some point, and that skews more towards women by 2-to-1 ratio, but men still do get them. For more on what they are and what puts you at risk, we check in with Dr. Mansour of Spectrum Health Medical Group.
The spider veins are the tiny ones. They're like maybe 1 millimeter or less, and they're right under the skin, and they can be blue or pink. And then you can go to the other extreme, which is big, ropey, varicose veins that are under the skin, really easy to see, at least 3 millimeters. Sometimes it can be all the way up to 8, 9, 10 millimeters in size, and you can see them from across the room.
And there's something that people want to get looked at or get treated or get fixed because of cosmetic appearances. They don't like the way they look, but also because of pain, correct?
Yes, absolutely. So again, you have a whole host of symptoms that can arise. The most minor symptoms are when people just don't look like the appearance of it. They could be on the legs or sometimes on the face. And then the larger varicose veins are usually associated with much more complicated symptoms like pain, heaviness, swelling sometimes, and in the extreme cases, you actually get breakdown of the skin and an ulcer, which is basically a bad problem to have.
Are these genetic? Some are genetic, some are caused by weight and other factors?
Yes, again, a whole host of things. Some of them are genetic, so you don't have any control over whether you're going to get them or not, but a lot of them are acquired. So that means that there's something that happened to you. The most common thing is pregnancy, for instance. Women who get pregnant tend to have more varicose veins. If their pregnancy is complicated, they may have complications with worse varicose veins. But being overweight, obesity certainly can make things more complicated. The other factor that we probably will talk about a little bit later is a blood clot in the calf. The famous reporter
David Bloom, right?
Yes, he was in a tank in the Iraq War and was in the tank crouched for many hours, and when he got out of the tank, he died. 20 years ago, the diagnosis was very difficult to make. It was an invasive procedure. It involved x-rays. Now we have an ultrasound or duplex machine, which is office-based. You can get the test. It usually takes somewhere between 20 and 30 minutes, and you get the results almost right away. It's instantaneous. You can see the problem right away, and almost right away also decide what you're going to have done.
Some tips from Dr. Mansour for avoiding spider and varicose veins are wearing sunscreen, exercising regularly, don't sit with your legs crossed for a long period of time, elevate your legs when you're seated, and get this one, don't wear high heels for long periods of time. I'm glad I have my flats on.
Boy, the sunscreen one is kind of surprising.
You don't really
wouldn't think about that. Yeah.
In a couple of weeks, we will talk with the doctor again and learn about treatment options.
All right, and don't forget, you can check out all of our medical moments. Just head